Examination of cranial nerves is incomplete without examination of reflexes. One such reflex that is being tested in this image is light reflex. What exactly is done here? As we can see, the examiner is throwing the light into eye, and this is bringing about a response, which is constriction of pupil. So when the examiner takes out the source of light, the pupil dilates. So this contraction and dilatation of the pupil represents the response for light reflex. Right? Now what brings about this? Of course, this checks the integrity of two important cranial nerves. One is the optic nerve and the other one is oculomotor nerve. But what muscles are responsible for this action, that is constriction and dilatation of pupil? This action is brought about by the intraocular muscles. And in this session, let's focus on the anatomy of these intraocular muscles. The learning objectives for this session are, at the end of completing this session, you should be able to classify what are ocular muscles, list the intraocular muscles, the extraocular muscles we will learn in separate session, then describe the attachment, innervation, and then actions and clinical significance of these intraocular muscles. Let's begin with classification then. The ocular muscles are broadly classified as two groups or broadly classified into two groups. What are they? These are extraocular muscles and then we have intraocular muscles. What do we mean by extraocular and intraocular muscles? As the name suggests, extraocular muscles are those which are present outside the eyeball. Right? Intraocular muscles are by definition, they lie inside the eyeball. This is the simplest definition. What are the extraocular muscles? Extraocular muscles are, we have obliques. Okay? Obliques which are two in number. What are they? These are superior oblique and inferior oblique. Then we have recti. We have four recti. Okay? These are medial rectus, lateral rectus, superior rectus, and finally inferior rectus. Then we have the levator palpebrae superioris. Some authors consider only these muscles as extraocular muscles. But few authors also include one more muscle which is the orbicularis oculi. Remember, orbicularis oculi is a muscle of the face. It's one of the facial muscle. But few authors also include this because this is concerned with closure of eyelids, which is also concerned with the orbit. That is why these muscles are referred to as extraocular muscles. When we come to intraocular muscles, there are three. The first one is sphincter pupillae, which brings about constriction of pupil. Then we have the dilator pupillae, which brings about dilatation of the pupil. And finally, we have ciliaris muscle. What is the action of the ciliaris? We will learn later. So this is the broad classification of ocular muscles. Once we have learnt about classification of the intraocular muscles, let's focus on each of them. Let's begin with identifying these intraocular muscles. If you see the eyeball, this is the central aperture pupil. Okay, now let's try to draw this again. So we have the pupil. Surrounding the pupil, we have the circular iris. Right? Now this iris is made up of two muscles, sphincter pupillae and dilator pupillae. If you observe, one of this muscle is concentrically arranged. Okay, so the muscle fibers are arranged like this. Right? These are sphincter pupillae. If you just closely observe, the outer part of the muscle is radially arranged. And this is dilator pupillae. So that's how we identify. So dilator pupillae are radially arranged just like the spokes of a wheel. Whereas the sphincter pupillae is concentrically arranged. This is the location of dilator pupillae and sphincter pupillae. If we come to ciliaris, now just to identify the structures, this is the cornea, right? And this is the anterior chamber, right? Then here we have a structure referred to as ciliary body. The substance of the ciliary body contains ciliaris muscle. We will learn more in detail about this muscle, but remember, ciliaris muscle is a component of ciliary body. This is the location of ciliaris muscle. Let's learn about each of these muscles now. First, begin with sphincter pupillae. So, as I said, this is the sphincter pupillae. How do we say? The fibers are concentrically arranged. Right? So, sphincter pupillae refers to concentrically arranged smooth muscle fibers which surround the pupil and present within the iris. Because of the concentric arrangement, whenever this is stimulated, it results in constriction of the pupil. Okay? And that is the reason why it is referred to as sphincter pupillae. Okay? Now, sphincter pupillae, remember, is innervated by parasympathetic nerves. Now, this is very important. They are supplied by parasympathetic nerves which bring about the constriction of the pupil. Done? So, sphincter pupillae is concentrically arranged muscle present within the iris, innervated by parasympathetic fibers. On stimulation, this will result in constriction of the pupil. Similar to that, we have the dilata pupillae. As we can see, the dilata pupillae is radially arranged. This is also present in the iris only, but the muscle fibers are radially arranged. So, these fibers are supplied by sympathetic nerves. Okay? Now, sympathetic nerves, when stimulated, will result in the contraction of dilata pupillae. Because of the radial arrangement, once contraction of the dilata pupillae occurs, this will result in dilatation of pupil, and that is why the name. So, sphincter pupillae and dilata pupillae are basically named because of what? Yes, their action. One brings about constriction of the pupil and the other brings about dilatation of the pupil. The major difference, remember, sphincter pupillae is supplied by parasympathetic nerves, dilata pupillae is supplied by sympathetic fibers. Done. The third most important intraocular muscle is ciliaris. As I said, the ciliaris muscle is present within the ciliary body. Usually, ciliaris muscle is arranged in three distinct directions. What are they? You will get longitudinal fibers, right? Then you will get radially arranged fibers, and finally you will get circular fibers. So, ciliaris muscle is arranged in these three distinct directions, right? So, what I showed here, let's say this is the longitudinal bundle, and then we have, let's say, the radial bundle, and then finally we have the circular muscle fiber. But all of them are present within the ciliary body. What about the innervation and actions of ciliaris? Remember, ciliaris is innervated by the third cranial nerve or oculomotor nerve. And this is also innervated by the parasympathetic fibers. Right? What about the action? The ciliaris muscle has two important actions. What are they? One, ciliaris is attached to the lens. The ciliaris muscle gives attachment of the ciliary body to the lens. So, whenever the contraction of ciliaris muscle occurs, it increases the curvature of the lens, which is essential for a reflex referred to as accommodation. Now, what exactly is accommodation? Whenever you want to see the objects near to you, you want to read, you want to write, you need to bring it into focus, and this is referred to as accommodation. Fine? Seeing of near objects. Ciliaris muscle, by changing the curvature of the lens, helps in this function. Apart from this, ciliaris muscle, by its attachment to the aqueous network, also improves the flow of aqueous humor within the eyeball. These are the two important actions of ciliaris muscle. Right? This is about the three intraocular muscles. Now, what about the clinical significance? As I said, the integrity of sphincter pupillae or dilata pupillae is essential for eliciting what? Light reflex. Okay? So, intact light reflex not only indicates the proper functioning of the two cranial nerves, optic and oculomotor, but also suggests your sphincter pupillae and dilata pupillae are functioning normally. Then, the ciliaris muscle. Ciliaris muscle is richly innervated with sensory nerves also. What is the significance? Because of this rich sensory innervation, any inflammation of the ciliary body will result in severe pain, severe ocular pain. Okay? Similar to that, even inflammation of iris consisting of sphincter pupillae or dilata pupillae will result in severe pain. This is because rich sensory innervation these muscles possess. Right? So this is regarding the clinical significance of intraocular muscles. Let's quickly summarize now. We classified ocular muscles into two groups. Right? So ocular muscles can be grouped into two, extraocular and intraocular. There are 7 or 8 extraocular muscles and there are 3 intraocular muscles. Intraocular muscles include what? Sphincter pupillae, dilata pupillae, and then finally we have ciliary body containing ciliaris muscle. Right? The actions of each muscle we discussed. The sphincter pupillae will result in constriction of pupil, whereas dilata pupillae will brings about dilatation of pupil, whereas ciliaris muscle is responsible for improving the aqueous flow as well as it plays an important role in accommodation reflex. Right? This is regarding the detailed anatomy of intraocular muscles. That's it for this session.